Hello everyone. So in today's educational video, we are going to see how varicose veins are treated, what are the treatment options available. But first, let's see, like we have seen in previous video, how varicose vein develops so that we can have better understanding about the treatment. So as you can see in this diagram, varicose vein develop because of the faulty valve. There is a big faulty valve, the groin area. Once it becomes faulty, blood will go down. Instead of going up, it will go down and then varicose vein develop. So this is the main vein in the leg. We call it is great saphenous vein in medical terminology. So we have to get rid of this vein because this vein is not useful now in the body. It is acting as a channel for blood to come down. Instead of blood going up, it is acting as a pathway for blood to go down. So in order to treat the varicose vein, we have to block this pathway to treat the varicose vein. So that can be done by either surgery or now we have non-surgical options also available. So any varicose vein treatment where you have this big vein problem that we understand by doing ultrasound, sonography, color Doppler test. So we need to get rid of this great saphenous vein. So we can divide varicose vein treatment option into two broad category. One is a surgical treatment and second is a non-surgical treatment. So let's first see the surgical treatment option. So surgery for the varicose vein, it is known as a ligation and the stripping. So surgeon will make a incision here. He will expose this part and he will ligate it with the suture, cut and ligate with the suture, and then he will pass a wire inside the vein, and also one more cut is made here. So the wire will come out of that thing, and using these two wires, surgeon will remove the entire vein. This is known as a stripping. So it's a ligation plus stripping. So this is a surgical treatment classically done for many years, but it has to be done under either spinal anesthesia, general anesthesia, and it requires few days of hospital admission, and it may associated with some bleeding, and now injury can happen. So it's like invasive procedure. So this is how surgery is done, ligation plus stripping. Now let's look at the second category of treatment, that is non-surgical treatment. So broadly we can divide into two, thermal base and non-thermal base. So let's just start with the thermal base treatment. So what are the thermal base treatment? Thermal means heat. Any device which will generate the heat, which will destroy the vein internally, is a thermal based method. So what are the various thermal methods? Laser, RF ablation, microwave ablation, these are the thermal based treatment methods. So using sonographic guidance, we put a small tube from this area around the knee joint area, and when we take a small either laser, RF or microwave fiber all the way till the groin area, and we start this 5 centimeter proximal to the junction, and then we give local anesthesia all around the vein. So then vein will become shrink, it will come in contact with the laser fiber or RF or microwave fiber, and then we start the machine. So from at the tip heat will be generated, and then we just pull out the laser or microwave fiber like this. So it will burn internal layer of the vein, and eventually this vein will be closed. So that's how this thermal based laser, RFA or microwave ablation is done. Now let's look at the second category of the non-surgical treatment, that is glue. Glue is the latest treatment available for treating varicose vein. So instead of laser fiber or RF or microwave fiber, this technique is same. We take a small tube all the way till here, and from the tip we inject glue. So we inject glue and then come back, come back like this. So this entire vein is filled with the glue. Glue is a medical glue, so it will stick the vein, it will block the vein internally. So this is a non-thermal based technique. We don't have to give multiple injection all around this vein. As we have to give in the thermal based technique because it can cause a skin burn. So in order to prevent skin burn, in order to vein come in contact with the fiber, we have to give multiple injections all around the vein in the laser or thermal treatment. But in the glue, it is non-thermal, so all those multiple injections are not required. So it is much more faster, much more comfortable, less chance of bleeding as compared to the laser treatment. So if you compare with the surgery, non-surgical techniques are nowadays a treatment of choice because of many advantages. All this technique, all these procedures, non-surgical treatment are done under local anesthesia or maximum femoral nerve block. So the recovery is much more faster. Or like you can walk same day, you can resume all the activities, all the work very next day. While surgical recovery will take much more longer time as compared to the non-surgical technique. So nowadays surgery is not done routinely. Either laser or glue techniques are routinely performed. Offers several advantages over laser because multiple injections are not required, proceeds faster, comfortable, less chance of nerve injury, less chance of bleeding. So this is the latest evolution in the technique of varicose veins. Thank you.